Most, if not nearly all, deaf children are born to hearing parents. And when you're hearing, your culture is oral, talking, listening, singing to your baby.
I'm over here.
These are all things that we just all of a sudden can't believe that we're not going to be able to experience with our child.
At the beginning, when you know he can't hear you, I just remember thinking there's nothing that I can do to change it.
And I immediately just shut down, like I just wanted to hold my baby and go home. And it was interesting because when my husband came in, he saw me crying and his response was so different. He turned and he said, well, what do we do? You know, like, what can we do?
Just that, the technology is so much advanced that I figure there was some hope somewhere.
It'll just be a few more minutes until we go back.
What we've created is a multidisciplinary clinic and a program, a center composed of specialists who have expertise in hearing, primarily with profound hearing loss, and speech, counseling, social work, just the support and education so that parents, our families, patients can come somewhere and kind of have some guidance through the process of deciding what they'd like to do for their hearing loss.
It just made us feel kind of relieved, like everything's gonna be okay.
Hearing aids are for a moderate hearing loss or mild hearing loss. It's a way of amplifying sound. A cochlear implant bypasses all of that in the sense that it provides the sound in an electrical signal past the inner ear and stimulates the hearing nerve directly. So it's acting as the inner ear would, but in a whole different fashion with the sophisticated computers and stuff, basically. So it's providing that sound at a level that you and I can hear normally.
Yeah, it looks very normal.
So that's wonderful. That's great news.
So I just did some testing on the device, and basically once the implant was in, we just looked at making sure it was making contact with the tissue and then stimulating the nerve. We actually got responses across the whole array. So, from like up from the auditorium. Mm-hmm.
That's good. It's going to be great. He did wonderful. Are you okay?
Yeah.
Are you okay? Oh, yes. Oh, thank you. It's going to be wonderful.
Here we go. Today's the day we're going to turn this on and see how it sounds for you.
I'm excited, but I'm also nervous because I haven't had much sound in the last few years.
I think our ability to communicate with others, in particular our family, our loved ones, is so much of what we are. For Jill, her family has been wanting to reach out to her in this way, in an oral verbal way, being able to talk to her.
When they found out I couldn't hear when I was 5 years old. Throughout the years, when I would get new hearing aids, I would hear new things, but I'm at the point where new hearing aids wouldn't help me at all. I'm hoping I'll be able to tell my kids apart, because right now they just sound exactly the same.
Yeah?
It's almost like I'm imagining it, though.
Okay. Yeah. Let me play it there again and see if you think you feel like you're imagining it, okay? Sometimes it's a little hard to tell if you're actually hearing it or not,
Right.
and that's fine. Yeah. Yeah? Okay.
Yeah,
What did it sound like? Did it sound like a beep?
kind of like a beat.
Okay. Yeah.
So somebody who has lost their hearing will describe that sound or the cochlear implant as sounding very digital or kind of not normal. But if you ask them a few years later, as they've been using it, their brain has now started to normalize that sound in what they remember, and it will sound more normal.
Ready, ship.
Ship.
Ready, rug.
Rug.
Talking to her is like she's never been deaf. I can look away and talk. She can look away. I mean, we don't have to just be right here focused like we have been for years. And it's just awesome.
Do you want a piece of me?
You want a piece of me? been a long time since I've been able to talk like that. Same with my kids, I can do that when we're at home. And I can just talk and be doing something, and I don't have to stop and look at them, and it's a lot less work.
I think the support of having an implant center, a multidisciplinary team as we have here at St. Luke's and Elks, is so important to becoming successful, because we also want people to know that this is something that's a process, it's work in terms of learning to use the device. And if they feel this is something that they want to do, we want to help them through that process.
Over here. There I am. Hi.
It never occurred to me that there would be something we could do, because when I was younger, for her hearing loss, you know, I'm deaf in one ear, and there was nothing for me. You question, you know, like, did I do the right thing? Was it worth it? And yeah, you know, like now, being able to see as he's growing, definitely worth it.
Yeah, pretty much sky's the limit for him now that he has, you know, the implant on. She gave us more hope than what we were expecting.